2, 1. Hello, Dr. Joe here, your red light helmet guy, transcranial photobiomodulation therapy, getting my morning brain activity on. I just want to share with you this new research that just came out, therapeutic efficacy of home use photobiomodulation device, a systemic literature review. And I'll show it to you here on the PubMed. Let's look at the authors. Pretty interesting. These authors came from Department of Medical Neurobiology, Hebrew University of Jerusalem, and the Laser Research Center, University of Johannesburg. They perform a systemic review of the literature on photobiomodulation devices used at home for non-aesthetic applications. They used a systemic review, and two independent reviewers screened the articles and extracted the data. 11 studies were suitable. Devices were applied for a range of indications, including pain, cognitive dysfunction, wound healing, diabetic macular edema, post-procedural side effects, and most were based on near-infrared pulse light emitting diodes with dosages within normal Walt recommendations. Home use photobiomodulation devices appear to mediate effective, safe treatments in a variety of conditions that require frequent applications. Conclusive evaluation of their efficacy requires additional randomized clinical trials. If I could just show you the paper. There's the paper there. Okay, let's just zoom in and I'll get to this section here, because they had a very good little article here. Abnormal wound healing, accelerated things like we talked about, but the results of the literature shows that photobiomodulation devices that are sold over the counter for home use are applied for a surprisingly wide range of applications with mostly positive results and without any reported adverse events, except one possibly that was not related. The devices are mostly based on LEDs and the near-infrared range of the spectrum, with pulsing and with power and energy densities within the range of recommendations. In comparison studies with their clinical counterparts, there are not many published studies using photobiomodulation in home, and these are published on relatively small series and case reports because they're clinical. That's how we use them. We've used them like that for over a decade. First on peripheral neuropathy, which they did have a case that they stated there, and also cognitive decline, which they did have a case that they stated there. Okay, so we are on the cutting edge here, fellas. There's not been very many research, okay? Not many published studies using photobiomodulation devices at home. But we're right there. We're the cutting edge. Way to go. More brain power, babe.